Okay, so the process. First, it's research. You're going to want to find the right doctor, the right procedure, which the sleeve, Roux-en-Y, or the lap band, although I think a lot of surgeons aren't doing the lap band because there's a lot of problems that come from that, and then the right hospital. I think I basically started off with calling my insurance company to find out doctors' names and who I could go to for insurance purposes. The seminar, which is like an hour and a half, I think, it's free. They talk about what the surgery is, and then I decided to go with a weight loss center that is affiliated with a hospital and the surgeon. And when you go there, you do an intake visit. You meet with the bariatric doctor, who isn't a surgeon, the dietitian, exercise physiologist, and the psychologist, and I got a body mass x-ray, and that was all in one day. The psych visit, you meet one-on-one with the psychologist, and then you take an eval test, which they said takes about an hour or so. And it asks questions that might seem a little silly, but and they kind of ask those same questions in different ways. They're trying to figure out where you are mentally, because you need to be able to handle having the surgery, mentally and emotionally. The following visit is really your first visit. My insurance, I had to go for 3 months, and it had to be an approved program, a weight loss program that was directed by a doctor. So that visit, I met with the nurse practitioner, the dietitian, and the psychologist again. They also do a blood panel on your first intake visit, and then based on that, you may or may not have to have additional blood work or other tests done. Mine was elevated a little bit, so I had to get another blood test done to double check, and then I ended up needing to have an ultrasound of my liver, I think it was. And so I ended up having to see a gastroenterologist, and everything's fine. Some people also have to have sleep studies to see if you have sleep apnea. Then the second visit, I was cleared with the psychologist, so I didn't have to see her anymore. The second visit was with the nurse practitioner and dietitian. At that visit, I was released to call the doctor, the surgeon, to make an appointment with him. So that appointment I made 2 weeks later, after my second visit with the weight loss center. And at that visit, I met with 4 other patients and basically had like a mini seminar where he explained the surgery. And then I have coming up today a pre-op, post-op seminar for the diet, and then my last visit is in couple weeks, and then the surgery is about 2 weeks after that, and I'm at 4.5 minutes.